My mother lived to be over 100, but I can tell you there were a host of clinical issues that we confronted leading up to that time. When I was in my 30s, she was first diagnosed with colon cancer, and that created a challenge because we were at a distance from where she lived. Fortunately, she lived with my sister, but nonetheless, we were at some distance from where she lived. My mother struggled, my sister struggled, and all of us did, because at a distance, you don't know whether to run to New York to care for her, how to manage things, how to give my sister guidance on what to do as the primary caregiver. My mother had multiple admissions to the hospital over time. I would average roughly 3 to 4 times a year. And there are only so many visits that you can make to drag an elderly woman out to these visits on a regular basis. And it was a real burden for my mother and a real burden for my sister. Because of the repetitive nature, each time we were summoned or had to come, we often began to think, this is probably the last time. You don't know when that's going to happen. So there was always an emotional seesaw with this. And I would call my children and say, look, this could be the last time that you see my mother. You really, I think you should come. I don't know what's going to happen, but I'll be getting to the hospital in a few hours. Why don't we all meet there? My son Adam founded Landmark a few years ago because he realized what we had gone through as a family in terms of caring for my mother was not the ideal situation. He believed and researched very, very carefully that there was a different way to be able to deliver care that would allow patients to stay at home and do what was in their best interests while maintaining them healthy. And that was really the goal in trying to recreate and make a different experience for people than what we had gone through. I'm Rich Boulder, MD. I'm a physician provider at Landmark in the Albany marketplace. I have to say I have enjoyed my role immensely because of the reward of going to patients' homes and hearing their stories, how they feel benefited by their experience with Landmark on a regular basis. And I know my mother would be so proud if she were able to see today what her grandson Adam was able to do to bring care to families in our communities. I'm Landmark, you're Landmark. Together, we're the Landmark family.